How do frontal and lateral lisps differ? Imagine trying to say a word like sun and hearing it come out all funny. That's what a lisp can sound like, but not all lisps are the same. Today, let's explore how two common types, the frontal and lateral lisps, are different from each other. A frontal lisp happens when the tongue pushes forward against or between the front teeth when making sounds like S and. This causes those sounds to sound distorted, almost like a TH sound. Think about how sun might sound like thun. The tongue is too far forward, and the airflow goes over the front teeth instead of through the middle of the mouth. Sometimes young children have this kind of lisp as part of normal speech development, and it can go away on its own. But if it sticks around, speech therapy can help teach the child to position their tongue behind the upper front teeth for clearer sounds. Lateral lisps are quite different. They happen when the airflow escapes over the sides of the tongue instead of down the middle. This makes the S and Z sounds come out as a slushy or wet sound, kind of like a squishy noise. Usually the tongue is in the right spot in front of the mouth, but it doesn't seal properly on the sides. Air then leaks out into the cheeks, which causes the distorted sound. Unlike frontal lisps, lateral lisps are not part of normal speech development and usually need targeted therapy. They tend to be more noticeable and can make it harder for others to understand what is being said. The main difference lies in where the tongue is and how the air flows. With a frontal lisp, the tongue pushes forward and blocks the airflow from going through the middle. With a lateral lisp, the tongue stays in place but doesn't close the sides, letting air escape sideways. This difference affects how the sounds are distorted and how speech therapy approaches each type. For correcting a frontal lisp, therapy focuses on retraining the tongue to stay behind the teeth. For lateral lisps, the goal is to help the person close the sides of the tongue properly so air doesn't escape. Both types of lisps can impact speech clarity, but lateral lisps often cause more noticeable distortion. Early intervention is important to help improve speech and make communication easier. Speech therapists use specific exercises to help retrain tongue placement and airflow control, making speech clearer and more natural. So, understanding these differences can help parents and teachers support children in getting the right help to speak confidently.